often recommended to people with hypermobility to help them build strength and stability, but most Pilates classes are not modified for hypermobile patients. It's important to modify these classes for a number of reasons. A traditional Pilates class often requires multiple position changes. It has a certain type of breathing that could encourage bracing and tension in the torso. It could be fast-paced. It might require that the hypermobile patient is asked to do things that they're not yet ready to do. We know that people with hypermobility often stop exercising for a number of reasons, including fear and anxiety around movement and exercise, instability, so not being able to control and stabilize their joints, and being given inappropriate exercises. So the Modified Pilates program is there to encourage slowing down, increase body awareness, increase proprioception, which we know hypermobile patients do lack, and that ability to build some sensory awareness to really slow things down so that they can start to move without fear and without anxiety about joint instability. For example, a traditional exercise that is often given out as part of rehabilitation and in Pilates classes is an exercise called Bird Dog or Superman, which resembles something like this, which requires the patient to be on all fours with a long neutral spine to be able to extend the limbs away from the center and lift them up with control. However, with a hypermobile patient, what you might see is a disorganization of the structure. So as we come into quadruped, we cannot organize the structure. So we'll see hyperextension of the elbows, compression at the wrists, and a collapsing of the upper back, maybe the head falling off, increased lumbar lordosis. And then the ability to actually move the limbs comes not from control and awareness, but more pushing through momentum and sort of brute force. So you get a sort of a movement that might look like this with quite a bit of instability around the torso compared to the more aware, expansive quality that we would like to encourage to avoid injury. So in our Modified Pilates program, we step back and we help the patient understand organizational structure, understand sensation and proprioception about where their limbs are in space, before we start to ask them to do more challenging movements like the bird dog that we just saw. How would we do that? We spend a lot of time supine initially. So getting a sense of the alignment of the spine, working on breath to really soften some of this bracing tension that patients have. How do we lift our arms, first of all? Can we lift the arms slowly with control and awareness, as opposed to this, which a lot of hypermobile patients would naturally do because they lack the joint control? Could I then lift one leg with control and maintaining a weightiness and a sensation in my pelvis? Could I lift both together? Could I extend both away without losing my control?